So I would say, schizophrenia is a medical name, it's a psychiatric doctor name for a collection of mental health symptoms and behavioral symptoms, also coupled with a decline in the person's ability to function in life, to live their life, maybe to be a student or to be a housewife or to be an auto mechanic. So their ability to live their life is diminished. And the other thing that's fascinating with schizophrenia is that it needs to last at least 6 months, and then there's no thing that the medical doctors can discover that's causing it. So it's a collection of symptoms of thinking and behaving, functional decline, and that the doctors we can't find anything common that would be causing those symptoms.
All right, all right.
Call that
So,
schizophrenia. So it's a very curious thing.
yeah. What is the most curious or unexpected assumption people make about schizophrenia?
hmm I would say perhaps the most common assumption is that people that have schizophrenia are dangerous and scary to everybody else in society. And the other thing is that it's a split personality, that it's two personalities.
Yeah, and what do you think about that? Is that true? Like people should think that, or would you advise them otherwise?
I would definitely advise otherwise. The biggest danger that people with that schizophrenia diagnosis that they have is to hurt themselves.
Mm.
And also, they don't take care of themselves, so their lifespan is maybe 10 or 20 years shorter than the average lifespan. So really that the fact that they're dangerous to other people is wrong. They're really more dangerous to themselves.
Mm.
And they don't have a split personality. That's a different psychiatric diagnosis.
Also, people with schizophrenia does not have split personality at all.
Because see the dissociative personality disorder and the nickname is split personality is actually an anxiety disorder. It's a different kind of diagnosis in schizophrenia.
And is that also called or referred to as multiple personality?
Yeah, so those are some of the nicknames for it. And then in the diagnostic books, it's nowadays being called the dissociative personality disorder. It's kind of rare. There is a specialist in Chicago, Dr. Brown. He treats that. That's his specialty, is the multiple personality disorder. It's rare and it's very fascinating. There's even movies made about it, like The Three Faces of Eve is an old movie. You may have heard of The Three Faces of Eve, about a woman that had three different personalities. Yeah.
Mhm. Wow, wow, wow. I remember a
Very
movie.
old, a very old movie, but schizophrenia is not that. It's yeah.
I remember a very good movie that is, I don't remember the name, but it is like a very long trilogy. And this one was the second one. And it was about a guy who kidnapped three girls and he has like 24 personalities. And the last one is very dangerous. Like he becomes like a monster, like a beast, very strong, and he can even climb walls and things like that. So let me see what the name of that movie is. Like,
Yeah, I don't remember that trilogy myself, but it is fascinating.
yeah, Split.
Oh, Split. Yeah,
Yeah,
fragmented or
yeah, it's Split. And let me see if I can get mm, James McCovey. I think is the actor.
hmm
That's a very good movie. And the first one was like 15 years ago or more. And the actor was Bruce Willis.
Okay.
Yeah,
Yeah.
the movie's name was Unbreakable. And it was a man that did not could not get hurt. Like he was in a train crash where everybody died but him. And when
Yeah.
he left the train, he was like with no signs of anything. Like he was not hurt at all. So he was becoming like really paranoid about himself. Like, why do I have this power to heal like this? And then there was something that like the movie's really, really good. And then this one, like 15 years later, this one is the second one from that first movie. Like they are related, but you cannot tell. Like you can see
Oh,
the second one without seeing the first one, and no problems. But
yeah.
then the director and everything said that they are all connected. And the third one, the last one, is called Glass.
Glass. Yeah.
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 You know, this famous actor from Pulp Fiction, Samuel
Oh,
Jackson. So
Samuel
in
Jackson. Samuel
sorry,
Jackson. Yeah. Samuel Jackson. Yeah.
Samuel Jackson, and in the third one, the three of them of the actors are there, like Bruce Willis, Samuel Jackson, and the other guy from
Okay.
Leeds. So yeah, it was a very good movie, by the way. So let's go
Yeah.
back to your expertise. And
Well, let me see. I did see Unbreakable, and it was a weird kind of like psychic connection between Bruce Willis and Samuel Jackson. That one was unbreakable, and the other one was prone to all kinds of bone fractures, and they had the opposite effect of each other, and they were kind of linked together
yeah,
somehow.
they were linked because they were like opposites, you know, extreme opposites. The other guy was completely breakable.
And he
That's
had a
really
cane.
funny. Sorry?
He walked. He walked with a walking cane made out of glass. Yeah.
Yeah. And he hurt himself out of anything. So yeah, that's a very good movie. Like those are, I would recommend that trilogy to see it like as a marathon, like the three of them to see it in a row. It's very good. Is there something you've heard a lot of times that makes you laugh because it's so far from reality?
Yes, actually. Um, and that's as we were talking about these multiple personalities and split personalities and dissociative personality, many people, way more than half of the people that I speak to that are not physicians and not medical people, and I say, "Oh yeah, I work with schizophrenia," and they say, "Oh, split personality." Uh, so they think they know what it is, but it's actually incorrect. It's not that because the multiple personality, as we're saying, is very rare. And schizophrenia has a lifetime prevalence of about 1% of the human population. Over your lifetime, you have a chance of schizophrenia. And it's a mysterious thing and involves, like I said, the hallucinations, false beliefs, um, functional decline in your lifetime. You're declining, you're not doing what you're supposed to be doing, and there's no medical cause that we can easily find. And that makes schizophrenia. And so it's really, sometimes I won't even correct the person. I'll just say, oh, I'll just kind of nod and smile. But sometimes I'll tell them that, yeah, it's not split personality.
Yeah, but it's good to know that it's completely different. It's not multiple personality. It's not split personality. It's just like a medical condition, as you said. It's something different.
Hmm.
Yeah,
Hmm.
that's good. That's good.
And that
Yeah.
just another word on split personality or the multiple personality disorder. It involves something very bizarre. And one of my friends in residency saw it. It's called psychophysiological phenomenon. So he had a woman patient, for example, and this was in the 1980s, and a person that I was training with as a resident. His lady patient, one of her personalities had been physically abused as a little girl, and her dad would burn cigarettes on her arm. And so
Wow.
when she turned back to that personality, there would be welts on her arm, like scars from the cigarette burns. And then when she turned back to her other personality, those scars on her arms disappeared.
No kidding.
It is a bizarre phenomenon. And so it's a very rare condition, this dissociative personality disorder, and it's called psychophysiological phenomenon. And people with schizophrenia don't have that.
Wow. So, what is that name again?
It's uh, psychophysiological phenomenon.
But that so and it's like a real life example where that person with signs of burn from cigarettes
Hmm.
disappear over the skin because that person changed or switched from personality.
Yeah, from this personality to that personality. Yeah, like from Susie to Jane. So Susie had been, abused as a little girl with the cigarette burns from her dad, to torture her or to discipline her. But that was Susie. But Jane did not. So Jane didn't have that. But Susie did.
And when it goes back to Susie, you
Then
can,
the scar shows up again.
is that for real? Wow.
Yeah, it's called. Like I said, it's very rare, very curious phenomenon.
It, it
We don't really
yeah,
know how to explain it.
yeah. It goes against the law of physics, you know, or any law. logical, you know, because that what makes me think about that is like our mind is so powerful and we are so far from being like at the full potential of what our mind is capable of within our bodies. So
Yeah.
that is another indication that we can definitely heal ourselves, you know, because if that happened, we can heal ourselves if we had more capabilities using our mind.
And there is a popular man out there, Joe Dispenza,
Yeah.
and he actually claims that he's able to do with some of his people that come to his workshops that kind of mi- miraculous healing, you might say.
Wow. 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 It's
Yeah.
amazing. Like we need to discover so much from within and from
Hmm.
outside.
Hmm.
It's amazing. It's amazing. Wow, that's a very good story. I didn't know about that. I'm going to search on it. It really
Yeah.
got my attention.
Yeah. Yeah. It's called psychophysiological phenomenon.
Okay. What do you think would surprise people most if they could see you what you see in clinic?
Hmm.
Yeah.
So the most surprising thing, if I'm talking to somebody and they've never been to a psychiatric hospital or clinic, there's no one in their life with that sort of thing. For them, I think the surprising thing about a person with schizophrenia is that they're just, my experience, they're regular people. They have their own hopes and their own goals. They're living their life. They just have these unusual symptoms, you might say. And that's the surprising thing is that they're not dangerous or scary or monsters or anything like that. They're just regular people.
Yeah.
And that's probably the biggest surprise that folks would have. It's like, just a regular person.
Yeah. 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 The biggest surprise, like, it's no surprise. It's just a regular human. That's good. That's good to know. And you have you have been an expert on schizophrenia, but have you ever also worked in other mental illnesses? Like, have you also focused on other parts of that?
Yes, because in the psychiatric hospital, there's a variety of conditions. So it's like, bipolar disorder, suicidal thinking, major depressive disorder without psychosis. So schizophrenia's got psychosis, those things with the consciousness, the hallucinations, delusions. So some of the mental illnesses do not have psychosis. Anxiety disorders, a common thing is insomnia, and then there's gender dysphoria, that sort of stuff. So I've had a smattering of experiences and other things. And then in the last several years of my career, I worked in an outpatient clinic and I got really surprised by doing some geriatric psychiatry. So saw some patients with dementia that is really hard to treat. Yeah.
Wow. You mentioned gender dysphoria. Is that right?
Yeah, that's a very popular thing in the media these days
Yeah.
for people that are having a sex change, the gender dysphoria. Yeah.
Yeah. Yeah. Can you explain a little bit more about that? What is your your knowledge on it? Is that I
That,
know think it's a little like how do you say that? It's a little hard to talk about that these days because a lot of people are into that, or there's like a movement, at least on social media, that looks very noisy, but I think it's not like that in real life. But yeah, there's like people trying to do that movement. But I don't know. I would like to know what you think.
Yeah, in my clinical work experience, it's been a very teeny tiny little piece of my clinical life. So I've read about it, given lectures, talked to people about it, and I would say it's for me, I believe it's on the rare side of life, and there's a couple of things that are coming to public attention that, of course, everyone in medical school studies about and learns about, but you may never see it. There's some diseases and conditions I've seen only once in my life. So they're not common.
Yeah,
And and for the
and
gender dysphoria and the people that want to have a sex reassignment, it's very high level in the media, but I think it's my opinion is that it's on the rare side.
Okay.
And then the other thing that I think it's very confused, it's a crossover confusion, is that a little boy or a little girl before puberty, they're still developing their sense of who they are. Jean Piaget, the famous psychologist, talks about cognitive development. There's things that the child cannot conceptualize. Their brain hasn't developed. And then now some people are saying our brains are fully developed till you're like 20, 21, 22. So another thing in the teenage years is really kind of discovering who you are. Am I more of a boy or more of a girl? Am I a tomboy? Am I a sissy? Am I a tomboy girl? Or I'm a sissy boy? And does that mean I need to have my sex changed in my body? Those are kind of normal growing up things for the little kid and for the teenager. And so I think it's maybe premature to say that it's really a gender. This is my opinion. It's premature to say that it's a gender dysphoria disorder, but I think it's a normal part of growing up and being human. As you come into deciding who you are, what is your identity in life? So these
Yeah.
are normal, and to then take it out of that realm of being normal, like a little, say, a 6-year-old boy who wants to play with dolls, or a 6-year-old girl who wants to play with little toy cars and trucks, that doesn't mean they should have their gender reassigned. That means they're just a normal 6-year-old boy or girl who's just playing around and trying to figure out who they are and what's going on in their life. And then in the teenage years as well, it's a lot of that change. Now, there is one psychiatric personality disorder. It's called a borderline or BPD, borderline personality disorder. And some psychologists and psychiatrists have described it as a what's if personality. So they will go through all these changes of their identity, maybe change their hair color, get contact lenses to change their eyes. If they got blue eyes, they say, I want to have brown eyes, so they have different contact lens colors. They may think, oh, maybe I should be a man, maybe I should be a woman. And that's part of the personality disorder. And I think that's very separate and different from the really true and probably rare gender dysphoria disorder, where people need to have a sex change. So there's a lot of conditions that mimic and overlap in normal human psychiatry and psychology, growing up as a little kid, as a teenager, or if you have one of these personality disorders where you're living that as if personality and you're changing around from this thing and that thing and hair color and eye color and changing religions and changing all kinds of stuff in your life, changing maybe sometimes dressing like a woman or sometimes dressing like a man. And there's even cases in history like Saint Joan of Arc in the Catholic Church. So many Catholic people and just people in general may know of French history. So Saint Joan of Arc helped the French to defeat English in battles in her century. She was beatified because she had a lot of religious ideas going on. But the other thing is too, she dressed up like a man. So she could be in the French army as a young man, as a late teenage, 20-year-old man. And then after working with the French army and helping defeat the English, so she was like a war hero, she continued to dress like a man. And the Catholic Church people did not like that. And she got warned multiple times to stop dressing like a man. And eventually she was executed by the Catholic Church for disobeying the rules to dress like a woman. But then later the Roman Catholic Church made her into a saint because of her prayers and her connection to God.
Yeah. Yeah. I know who she was and everything, but I didn't remember what was the exact reason why the church, you know, uh, punished her and everything. So it was
Because she
like
was dressing
only
like a man.
because she didn't. It's amazing. It's amazing.
Yeah. And she got warned multiple times, stop dressing like a man, and she wouldn't do it. She kept dressing up like a man, and they executed her, convicted and executed.
But I think that these days they have taken the gender reassign uh, like to the extreme reassignment. I must say to the
Yeah.
extreme, and but I always try to look the bright side of things, and I try to wear those shoes and see how to understand more deeply how those people can feel, and I think the bright side is that they are a little bit more freely to express what they feel when they are discovering who they are. The bad thing is that when you reassign gender, there's no way back. And then if you change your mind, that you might change your mind in the future because of that, not because of your taste, because everybody has so different tastes. There is a lot of special people around. They are special in a positive way, like really special. And they're like, I don't recall it very well, but I remember what I think to remember or recall that Freddie Mercury, uh, he was, in a family with no musicians, or there were kind of like music, but as a hobby or things, it was not that serious. And he became this amazing musician. He was, bisexual or gay, or, and
Yes.
and that's what I call when you are special. There are so many special people with so many talents, but then you start thinking about it's not only talent, it's also tastes. Like people who don't like, I know people who don't like milk, and I say, well, milk is so common that everybody should like it. No, there are people who don't like milk. So there are
Mhm.
so many things on taste and behaviors and talents, gifts, and things like that that I think we have to accept that more and see it as a normal thing, like whatever you are or whoever you feel you are, and you think that is like the real thing, just go for it because that's who you are. That's it. Like you're, the creation of God in the end. So it's great. And the thing is that society and this movement, I think there is something in the background, profit fit things, always money, always business, and clinics that want to have a lot of operations for gender reassignments and things like that. So that's where, and when you have this social pressure that I think you can understand much better than me
Mhm.
about the social pressure that people can have. Like I remember in the 80s, like everybody used to smoke. Now nobody smokes, or like few people smokes nowadays. And right now the tendency is to go to the gym, eat healthy, look strong, look fit, because there is all this exposure on social media, and people are doing that because they start to, yeah, to show the results and the good things and the benefits on social media. So everything is about social pressure. So if you are trapped in an environment where all people are saying, if you think you are a boy or a girl, you must change your gender. You can, have this. You can reassign it. A lot of people will get confused and will end up doing that. And I think you should accept yourself, whatever your taste is, and whatever you like, and whatever your gifts are. You have to accept yourself and live with it. Because, as I said, like I think there will be a lot more suffering from people who go through gender reassignation is good, or reassignment. How would you say that?
Yeah, I would say in America, I don't know other countries, but we call it a gender reassignment surgery for the so-called gender dysphoria diagnosis. And
Yeah,
I don't know the numbers, the epidemiology, how many people are doing that and how often it's been happening in the United States or other countries. But
okay,
it is expensive. And as you say, it's kind of irreversible.
yeah,
And maybe if you're for some women, it's kind of almost fashionable to dress up in men's clothing,
yeah,
and some men, it's not so fashionable. But I think Harry Styles is kind of breaking the fashion rule by being the first man to appear on Vogue magazine by himself wearing a dress. But as
yeah,
far as I know, he's not interested in changing having sex reassignment surgery at all. But he just wanted to wear a dress, and
yeah,
sometimes wears feminine type clothing. And
yeah,
but
yeah,
women,
behaviors like that.
I think women in the business world, they find it to be it gives them more power and more respect in corporate America if they dress in men's style clothes. And so that's a little more acceptable for a woman to dress in a more masculine style of her clothing than for a man to dress like Harry Styles in a dress on the cover of Vogue magazine, you know.
Yeah, yeah. I think women have more capabilities of doing more things, and it looks okay. It's not like a wow, like a scandal or anything like that. Like women have that power of playing with that more than men. And I remember when you say like to dress with suits and things like that. I remember Diane Keaton. She used to dress that way, and she was cool. Like everybody loved her, and I think she was very cool.
Yeah.
No,
So for most of my adult life, I've been wearing Panama hats. It's a very British male thing to wear a Panama hat.
yeah,
Now, in the last 5 years or 10 years, I see women wearing a man's Panama hat. It's like, that's a man's hat. What's this woman wearing a man's hat? Because women have all these kind of fancy women hats that they can wear that I could never wear, or at least I wouldn't wear them. And especially French. There's a whole style of French hats that are very beautiful that women can wear.
yeah.
Uh,
I think everything comes from the social pressure that we want to fit in and try to be in fashion all the time. So it's a if a daring person that doesn't care about what anybody thinks, and he's like a great personality and charisma and very cool. He start doing that as the first person, and then a lot of other people who has not that high charisma and personality start following. You know that's a very common thing in our nature in society. Like the one who is the most charismatic and more like the cool person is like other people will follow what they do. So yeah,
yes,
yeah, yeah. And
that happens a lot
yeah,
from
yeah, I think.
wearing certain articles of clothing you want to identify. It's like hero worship, you might say. So a young girl that dresses like Britney Spears or some famous
Oh yeah,
musician.
time remember.
Yeah.
Madonna had a very special and unique way to dress up, and a lot of girls starting to do that. But that's more natural and more understandable because she was a celebrity and a famous person that was
Mhm.
doing a lot of hits, and that time was like on top of everything.
Yeah.
It is more to influence other people like that. But in the with regular people, that also happens in a minor level. Like you know,
All the
the most popular person is the one who's being followed, and
all
yeah,
the
yeah,
And many people in the success world, like Napoleon Hill or Darren Hardy, or the people who talk about corporate business success, they say that your entrepreneurial level and your business success level depends on the 5 people you hang out with. So really, as human beings, we mimic other people, and
yeah,
that's normal. It's normal to mimic others, and uh, and so that's it. Tying it back to schizophrenia, that's something that's I think really important for the family. Is that the patient with schizophrenia will, at one level, as a human being, want to mimic what other people are doing, and so for the mom and dad in the family or the caregivers to really display, healthy behaviors in their exercise, their food, they're not using so much alcohol or maybe no alcohol, that will help the person with the schizophrenia diagnosis to kind of mimic them and be in that little support group. Like you say, we're like the sum of the 5 people around us.
yeah, yeah. Wow, wow, that's a very good advice.